What is causing your neck pain? Having neck pain can literally be a pain in the neck, but it can also lead to headaches and difficulty thinking, focusing, doing your job, and being the person that you want to be in this world. It can be more difficult when you don't know exactly what is causing this pain in the first place and what you can do about it. So today we're going to be discussing the different structures in your neck that could be causing pain, how they'll present or what kind of symptoms you'll have with them, and what you can do about it. Let's go, PT. The first thing we're going to discuss is arthritis. Now, it's very important to understand that if you're over the age of 20, you probably do have some neck arthritis. That's just because gravity's been pushing down on your head for a long period of time. And if you're older, then it's even longer, and it can cause arthritis over time. The majority of the population does have arthritis in their neck, but it doesn't mean that it's painful. So if you've had some imaging done, an X-ray or an MRI, and they say you have arthritis in your neck, that doesn't necessarily mean that's what's causing your pain, but it could be. So it's important to consider your symptoms in light with everything else, including your X-ray or MRI reports. So arthritis symptoms typically will come through as a grinding sensation. It may sound kind of crunchy in your neck. You may feel like there's sand in there. That's a lot of times people describe it to me as there's sand in there or there's gravel in there, and it just feels like it's not a smooth motion. This will often lead to a dull, achy pain over time. And people will say, you know, it gets harder to move my neck. It's stiff, especially in the morning after I've been sleeping or been more sedentary for a long period of time, or if you're at a desk or office computer for a long period of time. That sitting in one position or maintaining one position is what can cause those symptoms to increase. Other than gravity pushing down on our head, what are other things that can increase your arthritis? Well, your risk for arthritis is increased if you have increased muscle tension, because that puts more pressure on the joints. And when there's pressure on the joints pushing down, it makes it difficult for them to get the nutrition that they need. And they will start to lay down bone, that's what arthritis is. The other thing we see particularly with neck pain is when people have poor posture. So if you're sitting with your head forward, that causes the muscle tension to increase in order to keep your head on top of your shoulders, and over time, that can cause arthritis symptoms. If you've been diagnosed with arthritis in your neck, what can you do? Can you fix it? Well, there's nothing that we can do to get rid of the arthritis we currently have. However, there are things you can do, including decreasing your muscle tension, improving your posture, as well as just getting general cardiovascular activity to decrease stress and tension. All of these will help to decrease your risk of future arthritis. All of this will help to decrease your risk of future arthritis formation. All right, the next one we're going to discuss is disc degeneration. Now, the discs are the shock absorbers in between the vertebrae. The vertebrae are the bones that link together to make the spinal column, and the discs are the shock absorbers in between them. When they start to degenerate, they can start to bulge out or kind of form a pocket off to the side, which can put pressure on the nerves or increase the irritation in the local area. If the discal material actually escapes the outside of the disc, that's called a disc herniation. And what will happen is that the discal material will be outside of the disc, which means it has to be reabsorbed by the body. But until it is reabsorbed by the body, it can cause a lot of irritation because those nerve roots are right there. So if you started having an onset of numbness and tingling in your hands or your forearm or down your arm, it could be that that disc has either bulged and put pressure on the nerve, or has actually herniated and is baiting that nerve in an irritant that's really causing you pain and dysfunction into your hand and arm. Now, most commonly when people have either a disc degeneration or a disc herniation, what they'll describe is a sense of instability. So it's difficult to keep their head on top of their body, or they feel a lack of mobility because that disc is kind of getting wedged. So they'll feel like, I can't move it any further here. Now, the thing to remember is that any motion that's painful is contraindicated. So I do not want you to be going into painful motions and saying, oh yeah, this is like, it's limited, I can stretch it out or something like that. If there's a disc or even a joint problem, you're not going to be able to move past that necessarily. So we want to avoid painful motions to make sure that we're not irritating other structures during that time. Discs will heal on their own, and the primary thing that they like is rotation. So that would be sitting up nice and tall with your head on top of your shoulders. You would turn to one side as far as you can, and then to the other side as far as you can. Now remember, if this motion is painful, we want you to stay in the pain-free range of motion, because if you go into the painful range of motion, that causes the muscles to contract. If the muscles contract, that causes compression. If that causes compression, it puts more stress on the disc, which is what started this problem in the first place. But the discs do like rotation, so as much as you can tolerate movement-wise, make sure you're doing it regularly throughout the day. You may even find that your motion increases as you do more of it. Now, one of the primary things that I see in the clinic that causes neck pain is muscle strain or muscle spasm. And I think that this is for two reasons. One, obviously the arthritis can lead to this. Two, obviously the disc can lead to this. But three, many people carry their stress up in their neck and shoulders. In addition to that fact, if you are not breathing properly and doing that nice diaphragmatic breathing, you will be forced to use the accessory muscles of respiration. Now, those muscles are found up in here, in your neck. So if you're not using your diaphragm, you are going to be using these muscles up in here. They're not supposed to be used for breathing, except in fight or flight circumstances. Now, I understand that in today's society, we tend to live in a fight or flight state, but that doesn't mean it's healthy for our neck and shoulders. Being in this state will cause us to use these muscles of respiration for breathing, which causes increased muscle tension, which can lead to other issues, including that disc degeneration and even arthritis. The symptoms you'll often have with this is feeling like you want to stretch all the time. You'll feel like the muscles are tight, just like any other muscle, and I just want to stretch it out. And if I could just stretch it out, it would feel much better. The problem is there's no way to stretch it out. If you continue to use those muscles abnormally, they're just going to tighten again. If you're suffering with muscle strain or pain, then I definitely have some great tips that are going to help you. First thing, we've already discussed, you want to make sure you do your deep breathing. We've got to make sure we're using that diaphragm muscle to do that breathing, which will take some stress off of those muscles up in here. Also, diaphragmatic breathing activates the vagus nerve, which decreases our fight or flight response. The benefit of a decreased fight or flight response, activation of the vagus nerve, as well as decreased tone in the muscles in your neck and shoulders. Now, no matter what is causing your neck pain, I highly recommend you avoid sitting for long periods of time, especially if you're not able to sit in a good position. Now, often we talk about that good position, especially when you're at the computer, right? You want to be having head on top of shoulders, shoulders on top of hips, and making sure you have that normal curvature in your low back. However, this can be difficult to do if you're in different positions, such as on the couch or in your car, or even just sitting in a different spot for a prolonged period of time. So you want to make sure that you're in as good a posture as you can be. You want to ensure that your back is well supported when you're sitting so that you're not having too much stress and you don't have to overwork the muscles of the neck and shoulders. Tip number 3, no matter what is causing your neck pain, you want to use some ice. Now, I know a lot of people say, I don't want to use ice for my neck. It bothers me. I feel like it's going to increase my muscle tension. I don't feel good being cold. You only have to do it for 3 to 5 minutes. That's what the research indicates is the most helpful for pain inhibition or decreasing your pain. And if it really bothers you to have ice on your neck, I totally get it. You can either curl up in a blanket, sit in front of a warm fire, or even put a hot pack on your core, so near your organs, to make yourself feel warm so that the ice doesn't bother you as much. And tip number 4 for dealing with neck pain, I highly recommend getting some cardiovascular exercise. So getting your body moving, getting the blood pumping will help to significantly decrease your pain and also cause you to do some deep breathing, which again activates the vagus nerve and decreases tension in your neck and shoulders. Now choose whatever form of cardiovascular exercise you enjoy. It could be walking, it could be running, it could be swimming, it could be elliptical, it could be spinning or biking. Make sure it's something that you enjoy doing because that will help to decrease your stress, which will also help to decrease the tone in your neck and shoulders. Today we'll be addressing a topic that many of us can relate to, neck pain. Now, the question I commonly get asked is my shoulder pain connected to my neck pain? We'll explore the connection between shoulder pain and neck pain to know how they're contributing to each other or if one is causing the other. Whether you're seeking relief from neck pain or shoulder pain, or just curious about the connection between the two, I guarantee you'll learn something new in this video. Let's dive into the fascinating relationship between shoulder and neck pain. First off, what causes shoulder pain? So if you have shoulder pain specifically that's not being caused by your neck pain, there's several structures in the shoulder themselves that can cause pain. So you've got the rotator cuff muscles. Many people are familiar with these muscles, and they're the 4 that help to keep the shoulder joint in place when you're moving your arm. A lot of people have had a rotator cuff tear or strain and felt issues in their shoulder specifically because of this. Now, the shoulder also has several intricate joints that work together. It's always fascinating to me to know that your pinky finger, your little finger over here, is connected to your axial skeleton only by this joint right here. This is your SC joint, which shows you the importance of all the muscles and joints working together to be able to get your pinky all the way towards the ceiling. And of course, with all those muscles and all those joints, there's a whole bunch of bursas in there. Bursas are fluid-filled sacs, and they help to protect the joint from the muscle and the ligament that's going over it. So if you're having very specific pinpoint localized pain in your shoulder, my guess is that it's either a muscle, a ligament, a joint, or a bursa problem. All right, let's say that your shoulder pain did start as a pinpoint pain in your shoulder, and now you're starting to feel some neck pain. So you're wondering, how does it go from the shoulder to the neck? Well, there's a lot of connections in between the two, and it's many of the things that we've already talked about. First off, the muscles. You have a ton of muscles that start at the base of your neck that go into your shoulder. The muscle that most people know about is the upper trapezius. So that's this big muscle right here. Starts at the base of your occiput, which is your head bone, and goes all the way into your shoulder. A lot of people get a lot of strain with this when they're sitting at a computer for a long period of time because you tend to be kind of in this posture a little bit, and you can get a huge strain in your upper trapezius. However, there's also smaller muscles in there like the levator scapula, which attaches onto your shoulder blade, and your scalenes, which are these in front, which attach onto your first ribs. Now, you may not be aware that your first rib is located right underneath your clavicle. So your clavicle is your bone right here that you can easily touch. Your first rib is located right underneath it. So it's intricately connected, that first rib and that neck, and it's through the scalenes. Now, obviously, the nerves that are in the shoulder start from the neck. So all of your nerves start in your spinal cord. So you have your brain, your spinal cord, which goes all the way down, and through each vertebrae, you have a nerve that pokes out on each side, starting from C1, going all the way down your spine to L5. The thing is, if you have shoulder tension or improper posture, then that can actually put increased stress on the nerve, which sends that signal up to the spine. So some people start with neck pain that goes down into the shoulder, but some people start with shoulder pain that travels up into their neck. Another way shoulder pain can travel up into your neck is through your posture. Obviously, when your shoulder's hurting, you start not sitting correctly, you start not moving that shoulder correctly, which can then put strain through the muscles, through the ligaments, through the joints, through the nerves even, to send that pain back up into the neck. So what started in the shoulder can travel up. And one other thing that can cause shoulder pain to lead to neck pain is improper breathing. That's what I was talking about the scalenes earlier, because those muscles are in the front here and they attach to that first rib. If you are in pain, you tend to use these muscles up in here, those scalenes, which are the accessory muscles of respiration, instead of using the big diaphragm, which was actually built for that purpose. So the pain in your shoulder can cause abnormal breathing, which can then lead to neck pain. All right, so the most important question, what can you do about it? If you're having shoulder pain, how can you keep it from moving up into your neck? Or if it started coming up into your neck, what can you do about it? The first thing that you can do is watch your posture. Make sure that you're sitting in a good position. You want your shoulders over your hips when you're sitting. You want your feet equally on the ground to make sure your shoulder and neck are properly supported. The other thing that you can do if you're just starting to have shoulder pain is do some stretching. Keeping that shoulder moving normally and lubricated will decrease the impact to the joints, the ligaments, and the muscles, and keep that pain from moving up into your neck. Another thing that you can work on is your breathing. If you're having pain anywhere in your body, it's really important to make sure that you're focused on that deep diaphragmatic breathing. We're going to link a video here that talks about how to breathe properly, because in today's society, many people don't, whether they're in pain or not. But it's really important because when you get into pain, you start using those accessory muscles, and that just actually makes everything worse. And one of the most powerful tools if you're having shoulder pain is to do some cardiovascular exercise. Now, of course, you can only do exercises that you can do pain-free, because if you're doing something that's causing pain, it's just going to make everything worse. So finding an exercise that your shoulder can tolerate, but that can get that blood pumping, brings in those healing cells to heal whatever is your root problem. Now, you have to find a cardiovascular exercise that you actually enjoy doing, because it's really hard to do something that you don't enjoy. But even something like walking can be impactful when we're talking about shoulder pain. There's decreased stress through the shoulder with walking, and you tend to get that good arm movement. So that can be a really great exercise that can have a huge impact. Again, as long as it doesn't increase your pain. So there you have it. If you have started to have shoulder pain that is pinpoint in that you only have pain in one area, and you're sure that it started in the shoulder, those are some tips of things you can do to keep it from traveling up into your neck. Once it gets into your neck, the impact to the rest of your body can be pretty significant. So I highly recommend implementing these strategies today to eliminate your shoulder pain so it doesn't travel to your neck. How to fix a stiff and painful neck in 4 easy steps. If you've been suffering with neck stiffness or pain, it can be difficult to know exactly what you need to do to eliminate it. So today we're going to be discussing the 4 simplest steps that you can implement. And I promise you, you can implement these today after watching this video that will help to decrease your stiffness and get your neck moving better. Friends, when you're on your phone, I need you to hold it at eye level. I need you to make sure that you are not slouching while and looking down at your phone, especially for long periods of time. If you struggle to hold it up because your arm gets tired, I recommend propping your arm up on an armrest. You can use some pillows. Sometimes you can use a table. It just depends on where you're sitting. You need to keep your phone at eye height in order to keep your neck from having to look down for prolonged periods of time. The reason why is when we have to look down for prolonged periods of time, it stretches out all the ligaments in the neck as well as the muscles. So then when we try to put our head back up straight, it feels very stiff because everything's been stretched out. Maybe it's gotten sore. Maybe there's a little inflammation because we were there for too long. And then it makes it more difficult to move. When the stiffness increases and it's more difficult to move, that makes it more difficult for the neck to heal itself. we have to avoid the prolonged position, and we call it text neck. It's so popular and prevalent that it has its own name. We have to avoid the text neck, which comes from looking down at our phones for long periods of time. All right, so you fix your phone posture. The next thing I need you to do is fix your computer posture. I need you to make sure that when you're on the computer, your monitor is about an arm's length away. So you want to be able to put your hand out and your fingertips should be touching your monitor. If it's further than that, what happens is over time, we kind of crouch down because we're trying to see stuff. It can cause increased eye strain, which can cause other difficulties. But it definitely leads to neck strain because we tend to get in those positions for a long period of time if we're focusing on our computers. So make sure that your monitor is arm length away. And that's a really easy one to test because you can just put your arm straight out and your monitor should be right at your fingertips. Tip number 3. When you're reading, watching TV, any position for a prolonged period of time, you want to make sure that your spine is in a neutral position. So that's head on top of shoulders, shoulders on top of hips, feet planted equally on the ground. Now, this can be particularly difficult if you're reading or watching TV while you're on the couch. Many people tend to have these deep couches where they sit really far back. In fact, some of my shorter patients, they can't actually put their feet down to the ground. So what I'm gonna have you guys do is put some bed pillows behind you to help support your spine and move you further forward. Now, I recommend bed pillows because then you get that full support through your spine. If you just use a smaller pillow, like one you might find on your couch, it's going to support your low back, which is great, but it's not going to support that head and shoulders. Now, so many people work on computers for long periods of time. We have to talk about computer posture as well. So tip number 4 is making sure that your monitor is in the correct position and your computer setup is correct, especially if you're at the computer for more than 20 minutes at a time. Now, it can be difficult to find the correct monitor position because it really varies depending based on every article you read. So I try to keep things super simple. What I want to do is make sure that your eye level is right in the middle of your monitor. Because what happens is that as you're reading, you're looking up a little bit, you're looking down, you're looking side to side. So you're getting a little bit of neck motion while you're at the computer. This is actually a good thing because motion is lotion and it helps the tissues to heal. So you want to make sure that the middle of your monitor is at eye level. So in order to test this, I will actually take a measuring tape, measure someone's monitor from top to bottom, find the middle of it, and then I'll take that measuring tape and make sure that their eyes are right in line with the middle of the monitor. In order to find the middle of the monitor, usually what I'll do is put something like a Post-it note. I guess you could use a sticker or something. I usually use a Post-it note, and I put the top of the Post-it note right at the middle. So I want to make sure that when I line up their eyes, it's right to the top of the Post-it note. I realize that there's more advanced techniques that you could use to find the middle of the monitor. I'm just saying that that's what I do, and it tends to work pretty well. Now, the other thing that is super important is you want to make sure that your elbows are supported if you're at the keyboard for long periods of time. You want your elbows to be in roughly a 90-degree position, so your hands should basically be parallel to the ground. Again, you can get a little bit more specific about this if you are at the computer for prolonged periods of time. However, as a general rule, that's very effective to make sure that your elbows are supported at a 90-degree position, which decreases your risk of carpal tunnel syndrome, as well as making sure that your shoulders don't start to elevate, holding your arm in position. Now, a couple years ago, it became super popular to get rid of armrests on chairs. And so I have a lot of patients who don't have an armrest on the chairs, and they feel like this is to help their posture. But if you're on the computer for prolonged periods of time, that can cause a lot of muscle strain. So I want to make sure that you have armrests that are the appropriate height, that allow your elbows to be bent to 90 degrees and your hands to be parallel to the ground. I hope you've realized through all of this, the best thing that you can do to decrease pain and stiffness in your neck is to modify your posture throughout the day. We tend to get into these postures that actually increase our pain and stiffness throughout the day, and then we sleep in a bad posture, which tends to increase our pain and stiffness throughout the day, and it becomes a negative cycle. In order to break out of that cycle, we have to create some better habits that put our bodies in different positions that decrease the stress and the load. Do you struggle with neck pain specifically when you're sleeping, or find that you have increased neck stiffness when you wake up? Well, today we're going to discuss the top 5 tips that you need to implement in order to eliminate your neck pain with sleeping. Today's video is super important because not only will it decrease your neck pain and stiffness, it will also help you to improve the quality of your sleep. And as we like to say around here, when you're sleeping is when you're healing. So when you're able to get into that deep REM sleep, which will allow the pain generator, or the thing that caused all this pain and stiffness to start with, to get better. So the importance of the quality of good night's sleep cannot be overemphasized. This is why I talk a lot about sleep on this channel. I talk a lot about sleep in the clinic. It is critically important to make sure that you're getting a good night's sleep so that you wake up feeling rested and ready for your day. Let's get into it. The first most important tip is that you need to keep your spine in a neutral position. Now, this can be very difficult to do, so we're going to talk about all the different tools that you may require to get your spine in that neutral position. We're going to start up at the top of the head. The first thing you need to make sure is that you have support right here in your neck. So this little hole needs to be supported either on the side of your neck, you have one in the back of your neck too, in order to improve your quality of sleep and decrease your pain and stiffness in the morning. I use a pillow, it's called Pillowise, and it actually has a cutout that helps support this part of your neck. If you don't have a pillow like that, what you can do is roll up a small hand towel and place it underneath your neck. That will help to give you some extra support. Moving out from there, we need to make sure that this hole is supported. So making sure that your head is not sideways, too far down, too far up, depending on if you're a side sleeper, or even same thing if you're a back sleeper. It can be forward, it can be too far back. So making sure that this hole is supported as well is critically important. There are lots of great pillows out there specifically for that purpose. And I'll definitely link a couple of my favorites in the comments below. Now, moving down, ladies, many of us have a smaller waist than hips. So you may also need a pillow that's underneath your lumbar spine or in that curve of your natural waist to make sure that your spine is able to stay in that neutral position. And of course, ladies, again, looking at you, your hips are wider than your knees, which means you may need a pillow either in between your knees if you're sleeping on your side, or underneath your knees if you're sleeping on your back, to keep your spine in that neutral position. Now, I know that that sounds like a lot of supplementation and a lot of pillows that you're going to need, and you may not need all of them. Every body is different, but you should try using them and see which ones seem to be most effective for keeping you in a neutral position and decreasing your pain and stiffness. All right, tip number 2 is making sure that you have the right mattress and the right pillow. Again, it's critically important to make sure that our spine and our neck are properly supported throughout the night. Because if we have improper support, that means our body is kind of stuck there for hours on end, which can cause ligaments to stretch out, muscles to stretch out, joints to get compressed, fascia to stretch out. This can lead to more inflammation with sleeping, which then our body has to try to process during the day. And during the day, our body is not healing. It's when we're sleeping that we're supposed to be healing. But if you don't have the right mattress and you don't have the right pillow, that can't happen for you. So I discussed earlier, the pillow that I recommend is the Pillowise pillow because it has that cutout here for your neck and here for your head and shoulders. However, you can also use that towel roll here and use a very supportive pillow here to make sure that you're properly supported. Now, when it comes to mattresses, I get asked all the time, what is the best mattress? The truth of the matter is, The best mattress for you is the one where your spine is in alignment. So I can't necessarily recommend a mattress specifically. However, what I will tell you is I sleep on a very firm mattress that has a pillow top on top of it. Because see, I'm a lady and I got hips. And if I try to sleep on a really firm mattress, my hip is going to start hurting because I can't tolerate that pressure for long periods of time. But if you put a pillow top on top of that, then I still have that support, but my hip can sink into that pillow top and kind of create a little bit of a space in there so that my spine stays in a neutral position. And I will tell you, we bought our mattress about 2 years ago. And when we did, I went to the mattress store and I laid on the mattress. And that can tell you a lot because I laid down on one mattress. I laid there for 5 seconds. Right away, my hip started hurting. I got up and I said, not that one. So pay attention to your body when you're trying out mattresses. You want your spine to be in a neutral position and you should not feel any pressure points, especially if you're only laying there for less than 5 minutes. Tip number 3 is one that I cannot say enough. You have to avoid stomach sleeping, especially if you have neck and shoulder pain. Stomach sleeping is not good for anyone. However, if you're already having neck pain, every time you go to sleep, you are putting more strain on the ligaments, more strain on the muscles, more compression on the joints, and stretch on that fascia, which is only going to increase your pain. Plus, you're staying in that position for a prolonged period of time, which does not give your body the time to heal that it requires. I know it can be hard if you've been a stomach sleeper for years and years to change your position, but I really need you to work on this. You're gonna see the benefits of it. For my patients who have neck pain, the best position usually is side sleeping. Of course, when you're side sleeping, you need to make sure that you're filling in the different holes to make sure that your neck is in a good position, as well as that lumbar curvature, as well as that pillow between your knees to make sure that your entire spine is in correct alignment. But side sleeping is the easiest way to make sure that your head is staying in the correct position all night long. If you have a good pillow and you have a good mattress support, it makes sure that even when you flip over to the other side, you're still as supported as you should be. But if you find side sleeping to be difficult, then tip number 5 is for you, my back sleepers. Again, you want to make sure that the curve of your spine is supported. But for you, that towel roll that you're going to use probably needs to be about a half rolled up towel roll, because in general, the curvature on the back of our neck is not as big as the curvature on the side of our neck. You do want to make sure that your head is supported in a neutral position, and that's different for everyone. So for some people, I've had them use just like a feather pillow. They just need something very, very thin because their head is in alignment with their spine. However, I had one patient who was extremely kyphotic and he was stuck in that position. He required 2 pillows in order to make sure he was in the proper position. Now for my back sleepers, I need to make sure that your lower spine is in the correct position as well, including your SI joints. So for you, I'm going to recommend that you take those pillows and you put them underneath your knees so your knees are supported in a slightly bent position. Some people, 1 pillow is enough. Some people need to fold that pillow in half. Some people need 2 pillows to make sure that their hamstrings are unlocked, there's decreased tension through their SI joints, and there's no pain through their low back, especially if you're a back sleeper and you tend to stay there most of the night. So there you go. If you have neck pain, there's the things that you should and should not be doing to help eliminate your neck pain. You've been struggling with neck pain for a while now, and you're wondering why the doctor will not order an MRI. Or you've been struggling with neck pain and you're wondering if you need an MRI. Well, today's video, this is a question we're going to answer, and it's a very pertinent one for me because I just had a conversation with one of my best friends about that this weekend. So many people who have been struggling with neck pain feel like they need an MRI and don't understand why their doctor won't order one. or they haven't gone to the doctor because they feel like that's not going to be helpful. They're just going to throw pain medication and muscle relaxers at them, which isn't going to solve the problem, and tell them to go rest for 2 weeks, which they've already done all that, and it doesn't help anyway. So what's the point in going to see the doctor? However, you do have to go see a doctor if you want to get an MRI. And so people are wondering, should I go ahead and go to the doctor in order to be able to get that MRI? So today we're going to talk about what can the MRI show, as well as what can't the MRI show, because that's really an important question. When you're considering whether or not you need an MRI. And I'll tie this up together by telling you my friend's story, as well as what I told her this weekend. Okay, let's start with what can an MRI show? First thing, an MRI can show a lot of things, but I want to tell you with a word of caution, there's a lot of research out there that shows that the MRI does not necessarily show what is causing your pain. Let me explain. After the age of 20, our vertebral discs, which is in between each of the vertebrae, you have those spongy discs, does not have a direct blood supply. So what the research is showing is that after the age of 20, we start having some degenerative changes that we can see in our spine and in the discs. And I can tell you there's been plenty of evidence out there now at this point, particularly with low back pain, but the neck's basically the same thing, that show that after the age of 40 and definitely after the age of 50, there are degenerative changes in our spine. Now, you may be saying to me, well, Dr. Amy, you said that every tissue in your body is designed to heal itself as long as it's moving correctly. And I would say to you, yes, and that remains true. So what I'm telling you is that after the age of 40 and 50, our spines do not move correctly, which means that the joints don't get the nutrition they need and the discs don't get the wringing out they need to bring in the nutrition and allow for total healing. And I will tell you, there's plenty of research out there to support this, that over time there are always degenerative changes, but that's not necessarily what's causing your pain. So what can you see on an MRI? The first thing you can see is if there's worn out joints or arthritis in the joints. So again, if the joints are not gliding correctly, they're not going to get the proper nutrition in order to heal. You can also see a bulging disc or a herniated disc, or if there's any damage to the disc at all. Now, discs require rotation in order to get the proper stimulation for healing, and many of us do not rotate properly because our spines are not properly aligned. So the majority of people do have disc issues in their neck and in their low back. They just don't know about them because they haven't had an MRI. An MRI can also show if there's a nerve compression issue. So most commonly, this will be due to the joint or to the disc that will be putting pressure on the nerve. Now, what the MRI can't show is if there's an extreme amount of inflammation that's irritating the nerve root. So that's a different thing than if there's a true compression. MRI can show the compression, but doesn't necessarily show if there's a large amount of inflammation that's irritating that nerve. And the MRI can show if there's a disease process that's affecting any part of your spine, which may be important in regards to if you even have access to normal motion. Now, the really frustrating part for many of my patients, and as it turned out my friend this weekend, is that the MRI cannot show if there's a muscle strain or a muscle issue. Now, obviously, yes, the muscles do show up on the MRI. However, it doesn't show if there's a problem with the muscles, if there's too much tension, if there's a strain, if there's something going on. Now, if there's a tear in the muscle, yes, the MRI is going to show that. But commonly when we're talking about the spine, that we're less likely to have a tear. We see those more in like the hip or the shoulder or something like that that's a little bit more mobile. In the spine, what we tend to find is that there's a muscle tension issue as opposed to a true tear. And this gets really frustrating because my patients go in and get an MRI of their neck or their low back, and they say, well, the doctor says that nothing is really relevant, but look, there's all this stuff on the report, which is exactly what happened to my friend. So she had a work injury and she went to the general practitioner who told her to take pain medication, muscle relaxers, and rest for 2 weeks off of work. So she did all of those things as she was told, and her symptoms did not improve, and she did not feel safe to going back to work because she has a pretty physical job. So the doctor sent her to a specialist, and the specialist ordered an MRI. Well, she just got the MRI report back last week, and she has 5 bulging discs in her neck. 5 bulging discs. So, she's my friend. She's a little bit older, okay? Now, luckily, she saw a fantastic specialist who told her, yeah, I know you have 5 bulging discs, but you had those before your injury. To which she responded, quite reasonably, how do you know? And he said, because you can see that these things have been here for a while. So the thing is, when there is a bulging disc that has been there for a while, this is even true with a herniated disc potentially, you can see some changes in the joints and the tissues surrounding it that tell you this is not a new thing. Now, you can imagine how frustrated my friend was because she just found out that she has 5 bulging discs and she has all this pain, but she's had the bulging disc forever, but she didn't have the pain. So luckily, fantastic doctor explained to her that what was happening is she had this muscle tension that was causing increased compression through the disc that was irritating everything in her neck. So what does she need? You already know the answer. You've been on this channel for a while. She needs some physical therapy. So she started physical therapy this week in order to loosen, stretch, strengthen those muscles to decrease that pressure on the discs so the disc will stop being irritated. And for her, the muscle tension is also leading to headaches, so it will help with that too. So when she called me this weekend to talk to me about this, she was like, can you believe what this crazy doctor said? And clearly he doesn't know what he's talking about. I think I need to find another specialist. And I was like, no, you actually found an amazing doctor because he told you the truth. He told you that you had these disc compression issues. He explained to you that these disc issues you've actually had for a long period of time, but the injury caused a muscle tension issue that is what was actually causing your pain. The great news about this is that means this can be fixed because what you're actually suffering from, what is actually causing your pain, is the muscle tension issue. Now, if she gets a muscle tension issue under control, she can actually do some exercises then to improve the discs in the long term and improve her long-term outcomes. Which, she's my friend, so I'm going to be on her about that in the long term. Right now, we're just trying to make sure she gets out of pain. So I hope that that is helpful and encouraging to you. If you feel like I got an MRI and it looked horrendous and I don't know what to do, why is my doctor not doing surgery? That's probably why. And I'm hoping that you have a fantastic doctor and they explain that to you. And I am hoping that this is just confirmation of everything they said so that you feel encouraged that other people see things this way too. The challenge is that many of us were raised when MRIs were new and they were thought to be this miracle thing that we could see what was going on inside the body. And to some degree, that is true. However, we also found out that there's a lot of things that were going on inside the body that we just didn't know about before. So now that MRIs have been around for a while, we're starting to be able to look at people who are symptomatic and that they have pain, as well as people who are asymptomatic who have never had pain, and understand and compare how their MRIs look. And what we're finding is that there's not necessarily a difference between the symptomatic people, the painful people, and the asymptomatic people or the pain-free people. So if you have an MRI that is just full of words that you don't understand and you have been questioning why your doctor's not recommending surgery, I hope that this helps make sense of this question for you. All right, to review, what can an MRI show? It can show a joint issue, it can show a nerve issue, and it can show a disc issue. What can an MRI not show? It cannot show if there's a muscle tension issue, if what you're suffering from is more of a compression issue because of that muscle tension, or even if you have a malalignment issue that is really what is the root of your cause. If this video was helpful, boop that like button because that helps the algorithm, and don't forget to subscribe for more great content.